The study that I presented here was about survival of childhood cancer in Iran. We investigated survival of childhood cancer in 8 provinces of Iran using population-based cancer registry dataset. The study was a retrospective cohort study. We used data from registered patient in 2014 to 2016, and then did both active and passive follow-up in order to ascertain their vital status at the end of follow-up. Our outcome was 5-year survival, and yeah, according to our result, the survival for we investigated 2 cancer, leukemia and also central nervous system cancer for childhood. The patients were aged from 0 to 40, and we enrolled 1,800 cases. The survival rate for leukemia cases was like 68%, and it was 48% for CNS. Childhood cancer is kind of devastating health circumstances leading to significant DOLI across the world, and most of this DOLI happens in low and middle income countries like Iran. But unfortunately, there is not enough evidence figuring out how much is the survival rate of childhood cancer in the countries like Iran and other low and middle income countries. So first of all, in order to do something, you need to know what is the problem. And in this study, we figured out how big is the problem. Yeah, probably the first one is the public awareness regarding of childhood cancer. Most of the time people in Iran and other countries like Iran are diagnosed in advanced stages, leading to lower survival. Second obstacle is the lack of enough access to treatment, and also easy access to diagnosis. Even if you know the sign of cancer, you have a problem getting access to diagnostic facilities. So, and you know, in countries like Iran, most of the health services are concentrated in central part in capital of the country, and there is kind of disparity in this regard, geographical disparity, I mean. Most of the treatment options for childhood cancer patients in Iran are based on a charity which is called Mahak. Most of people who are dealing with childhood cancer have to travel to Iran in order to get access to the treatment of the charity-based treatment in Iran. And yeah, removing the difficulty to access to the treatment, removing the difficulty to access to early diagnosis of childhood cancer could be probably the best action we could take in order to improve the survival of childhood cancer in Iran, particularly for those provinces that are with lower socioeconomic status. Well, the most important things improving survival of cancer in Iran for me is improving in the quality of life of people. When you're increasing socioeconomic status of people in a country, so uh, the first thing that comes is that improving the health outcome of people, and cancer is one of those health outcomes which is impacted. And we in another study we did in a remote region of Iran, in the northeastern part of Iran, we observed that after improving access of people to diagnosis, treatment, and also improving the quality of life, survival of cancer, esophageal cancer, has been improved significantly, like 20% increase in it. And the survival rate in that region of Iran, which is quite remote region, is comparable with developed countries like US.